So this presentation is on infection control, donning and doffing specifically, and the disposal of PPE. So the outline for this, we're going to be looking at adverse outcomes, how people are affected, who's affected. If an outcome were to happen during my internship in the field, what should I do? And ensuring if these adverse outcomes happen, or how can we avoid them happening? What type of situation can this happen in, and how would you report it? So for the adverse outcomes, overall PPE, especially with donning and doffing, is the dressing and removal of personal protective equipment, so gowns, gloves, masks, if needed, goggles or safety glasses. It prevents transmission of different diseases or any other contaminants like bodily fluids, blood, urine, sweat, if someone is contaminated, and it prevents cross-contamination. So an adverse effect of this would be cross-contamination between a patient from another patient, which could be transported through a healthcare provider. And in this little link here, if you click on that, that will pull up the CDC's outline for the actual sequence of proper donning and doffing and disposable. What happens if this is not followed? The healthcare workers and the patients will be affected. If a patient were to have a disease as what we're going through right now, like COVID, and you are not properly donning and doffing your PPE equipment, you can expose yourself to that virus and potentially contract that virus. If an outcome like this were to happen during my internship, I would obviously inform my supervising physical therapist. I would also see what the next step is. Maybe I have to get tested if I got poked where bloodborne pathogens are around, and it poked my glove. If I was wearing a glove, I would obviously go get tested and make sure that everything is done properly and documented, so that way if anything was contracted, it can be taken care of. This is a quote that I took from the Institute of Medicine, where adverse outcomes to non-compliance of proper PPE donning and doffing can and will expose healthcare workers, obviously what I basically just explained, to dangerous fluids, diseases, toxins. It doesn't matter what it is, but you can be exposed. So overall, who's affected? Healthcare workers, patients. Patients are our main focus when wearing PPE. We're looking to not only protect ourselves but the patients from contamination from outside of the hospital. Say you have a respiratory patient and they can't be exposed to anything that could potentially make them worse, where they could get pneumonia, they could get bronchitis, they could get a infection. So PPE can protect them. Now protecting ourselves is contracting, like I mentioned, like COVID-19. That prevents us from contracting that, not from the patient contracting something from us, but at the same time it still is. So standard precautions, they include the infection prevention, and it has to apply to everyone. Like I mentioned, respiratory patients are at a higher risk for contaminations, especially if someone has an underlying condition or an already weak immune system. So the role for a PT and PTA in this situation is to ensure that we are properly donning and doffing. The sole responsibility of the PT and PTA, especially us as PTAs, is the patient's safety and health. If the PTA notices a change in the patient's condition and believes that the patient could be infected, that has to be reported. So that goes along with the reporting as well. Not only if something happens to us and we have to report that, but also if we notice something different with a patient, that has to be reported as well. We have to look and see if possibly they were exposed to anything. The PT and PTA obviously have to follow the guidelines, the proper donning, doffing, especially the disposal of the equipment. So preventing this, based on what I learned in the physical therapy course, is a lot of education, making sure that everyone knows how to properly don and doff, making them run through it in front of someone that's trained professionally. Doing routine stuff and training, yeah, it's something that people tend to do almost every day in their work field, especially if you're working in an inpatient setting, but it's still always good to run through it continuously. So again, patient education, provider training, make sure that that's done at least annually. So ensuring that this is implemented, again, this is another quote that I took, but it from the Institute of Medicine, someone reported that seeing in a healthcare setting where people actually want to improve on their leadership and improve their learning environment, and that they want to make it a safe place to work, that they tend to improve and they will contribute more. So they would have to do, the continuing education, regular training, like I mentioned, which the CDC does offer, and positive reinforcement. So a reflection for this, for me, focusing on PPE precautions and proper donning and doffing is important for my safety in the future of the field, just like how I'm going on clinical within this next semester, and I'll be going in a nursing home. Now I've worked in a nursing home, I know infections can spread very easily. I know how just the simple flu can spread. This will prevent me from contracting that, but also those patients who are very susceptible to these things. And even working in a hospital, just knowing how to do this will benefit my health and my future patients' health. And these are my references, and that is it.